Hi guys, today I want to build on my previous video on foot drop. I established in that video that the two commonest causes of foot drop are fibular nerve injury and nerve root disease at about L5 level of the fifth nerve root in the lower back. So today I'm going to do an extension of that video and I'm going to blow your mind about some of the simple things that we do that we don't realize can actually cause injury to the fibular nerve and causes foot drop. So just a few days after that video, I saw a guy in the clinic who was referred for foot drop. And this guy is 14 years old, 1-4. So it shows two concepts. One is the fact that no one is too young to have foot drop or injury to the fibular nerve. It's all about whether or not we get exposed to the risk factors. And some of those risk factors is some of the things we do from day to day without realizing that we're actually putting our nerves at risk. And that's the essence of this video. And it has to do with the way we sit. When we sit and cross our legs like our females like to do, that can actually lead to injury to the fibular nerve because this nerve passes on the external side of the knee and rides on top of the head of a bone called the fibula. And it's very vulnerable at that area because it's very superficial with very little or no fat at all to protect it. So when we cross our legs, we put an external pressure on the knee at that area, and that sits right on top of the nerve. So the nerve gets sandwiched between the fibular head and the knee, which is on top. So that can lead to significant pressure on the nerve, and the nerve can fail, and that leads to foot drop. So I have seen not only this guy, and I must admit he's one of the youngest I've seen with foot drop. We also had one of our doctors, we had foot drop just merely because of the way she sits in the clinic. As doctors, we sit for several hours, seeing patients, so for 8 hours, 9 hours, with her legs crossed. So one day that led to significant injury to the fibular nerve, and she came down with foot drop. So next time you're about to sit and you're crossing your legs, think about this. And I'm not saying you shouldn't cross, but if you have to cross your legs very, very frequently, you need to uncross them to make sure that you're not putting pressure. Or you can study the video and see where your nerve is so that you can avoid pressure in that area. I do hope you learned something from this video. If you did, I encourage you to like the video, share, give your comments, and of course subscribe. And I hope to see you again on my next video. Thank you for watching today. Goodbye.